I chose to come to AMC for a lot of reasons. I think that an internship year is always going to be difficult, it's always going to be challenging, and so I wanted to do my internship somewhere where I was surrounded by world-renowned doctors at state-of-the-art facility and get as much experience as I could with a hospital with a big caseload.
I chose to continue my education at AMC specifically because of the clinicians here.
I was an intern about 20 years ago here at the AMC, and what I found really quite exciting about the program is, one, the size. So having a large intern class means that you have a lot of people that are going through the same thing you are, and you can build relationships, really, I think that lasts a lifetime. The diversity of caseload is really like no other place. We see primary care as well as specialty referral, and oftentimes we'll see even tertiary referrals from other specialty hospitals.
I was drawn to AMC because I was lucky to spend a lot of time here during externships, and I witnessed really the incredible mentorship.
I decided in my fourth year of vet school that I wanted to do a surgery residency, and I came to AMC in order to get the education and the training to allow me to be a good candidate for residency applications.
The AMC intern program is very different from other intern programs because I think it's a very intense learning experience. When you come out of veterinary school, you have all the book knowledge, but you don't know how to apply that. So this is a very intense experience in learning how to do that on a day-to-day basis.
The AMC internship is a year-long comprehensive experience where you are acting as a doctor, as a veterinarian. You're rotating on all of the different specialty services. You spend about a month on 12 to 13 different services. Sometimes you spend 2 weeks. So you are assisting the residents and staff doctors, board certified doctors, in their day-to-day with appointments, surgeries, and then really where you're getting the biggest learning opportunity is services like emergency and internal medicine, where you're taking cases primarily to yourself. You're doing all of the communication with the clients. You're working pets up, obviously with the aid of the board certified clinicians so that you have a safety net. And so those are the rotations where you're getting the most from your internship. And so you spend a year, immerse yourself. It is very hard. It's a lot of hard work, but it's very worthwhile. And at the end of the day, you become a fantastic doctor in just 1 year of time. You probably get 3 to 4 years worth of experience in 1 year.
So the day-to-day at AMC definitely varies based on what service you're on. Typically services that see appointments, you will prep your cases in advance. You'll see your appointments with a staff doctor and the residents, and then you will do the various procedures and diagnostic testing that you need. While on emergency, you are here and you just get whatever case flies through the door, and you get to choose and make your own path in terms of diagnostics and procedures that you want to perform for those animals.
So the day-to-day at AMC really varies on which service you're on. For example, I'm on internal medicine right now, so you have days where you have pickups, so you'll take in new inpatients. You'll typically start your day by looking at your current inpatients, and then you may have procedures, you'll have teaching rounds, case rounds, you'll maybe see appointments. It really can vary.
Throughout the internship, you are working with and learning from, because that's what they're there for, and they love to teach, all the board certified specialists in the hospital. So that's at AMC, anyone that's working here as a board certified specialist loves to teach. That's part of, this is a teaching institution, and that's part of why they chose this as their career. So throughout the day, you're either doing appointments with them, you're in surgeries with them, and I use that time to ask them questions as much as possible to try to pick their brains, see what they have to say about certain situations. And so that's where you can gain the knowledge from them. Additionally, they're giving you lectures in the mornings. It's a different lecture every day, but you're getting an hour-long lecture in the morning from the board certified specialist. So not only are you getting formal didactic teaching, you're getting on the clinic floor teaching every hour, every minute of the day.
So what sets AMC internship apart, I think, is that the huge variety of cases that we see, the high volume of cases that we see. We also have a unique experience here in that the interns get to work directly with the specialists from every department, and we have almost every department represented here. But we also have a very intense didactic learning experience here. We have lectures, we have rounds.
One of the things that makes AMC really special and unique is that as opposed to doing an internship at an academic institution or pure private practice, it's really a combination of both. Having primary case responsibility of primary patients that are not necessarily referred means that you're going to get a lot more depth of what you're seeing. The benefit is that not every person that comes to the AMC for an internship knows that they want to specialize. They don't know what they want to specialize in. And the fact that they get to see those patients from square one really might direct what they're most interested in and what they develop more of a true passion for.
I think what makes AMC different from other internships is the camaraderie. It really is a family here. Everyone knows you are working your butt off as an intern. We know it's somewhat of a rite of passage to go through this internship, and the family here is incredibly large. I mean, we have AMC interns all over the country, and I've gone to places like California and Georgia when I was interviewing for residencies where, they did their internship here, and all they say is how much they miss this place and how fun it was and how much you got to do and to learn, and they were doing these new techniques. Oftentimes you are alongside with the new techniques that everyone at the AMC is performing on pets. We're working with human physicians at some of the top human facilities in the country, which we're situated right in the middle of. The interventional radiology service is constantly bringing in MDs from Lenox Hill for cool procedures. As an intern, I got to spend time with them, and we brought in the interventional radiology neurovascular specialist from Lenox Hill.
The difference really here is the collaborative effort. At universities, there's also some feeling of collaboration, but they don't have the same caseload. So at the AMC, you can walk down the hall within 30 steps. I might see a cardiologist, I might see a surgeon, I might see the ultrasonographer without trying to search the building or go somewhere else. It's an instantaneous feedback that really puts energy in this building that you don't get other places.
The Animal Medical Center is very committed to the safety precautions during COVID. We are following the New York State guidelines, and everything that we do, be it mask wearing, social distancing, disinfection of the environment, health screening of employees, health screening of clients.
The AMC's taking a number of different safety precautions to protect us in the new norm COVID world in New York City. So one of the best things I think they're doing is kind of contactless exams. So we get the pet up, we talk to the owners on the phone, we examine the pet, and then we talk to the owners on the phone afterwards. So there's been a few times when I've wanted to introduce myself, so I will go outside and wave at them from 20 feet away, but there's no necessity, there's no requirement to do that, and that's one of the best things, so we don't feel uncomfortable when we're seeing, and we can still see the same caseload, so we're not down on caseload, and we get to deal with the patients. And I don't think we're losing any nothing is being done wrong medically by not being able to talk to the owner in person. We're using videos more, we're using documents more that the owners email us, so that's excellent. Additionally, we're required to wear our masks throughout the hospital. We're setting up plastic barriers in between computer stations.
If you are considering an internship or an internship at AMC, you should do it. It's 1 year of your life where you're gonna work your butt off, and you're not gonna sleep a lot, and you're gonna be tired most days. You're gonna get addicted to caffeine, but you will learn more in those 365 days than you will any other year of the rest of your life. And you cannot beat that, and it is absolutely worth it. And you get to live in New York City, which is the greatest thing in the world and the greatest place in the world, so it's worth it.
There's a huge advantage for interns at the AMC in terms of the fact that we are not just an internship program. we have very robust residencies in every specialty. And so interns are learning not only from staff doctors who have been out in practice for a long time, but they're also learning from residents who just went through internships. And there's an advantage to the staff doctors where, you know, if you're out in private practice, you might shut down your knowledge stream. You might not be a lifelong learner. And because we are training residents, we are lifelong learners, and we're imparting that knowledge not only on our residents, but also on interns.
To any vet student considering doing an internship at the Animal Medical Center, this is truly a jump-off point. This is a jump start for your career. All the people that have trained here have gone on to residencies, they've gone on to academic programs, they've gone into public health, they've gone into private practice, and you do it, you just accelerate your career. You're learning all kinds of things that it may take you 5 years without an internship, and you're going to be exposed to that. And you're also going to hone down into what you enjoy and what really, really catches your interest in veterinary medicine, and that is your jump start to going on into furthering your career, wherever that may be.